Darami, I say, whenever I leave the house, and on whatever thing my eyes fall on,
وسلموا تسليما حتى تنالوا جنة ونعيما صلوا عليه وسلموا تسليما حتى تنالوا جنة ونعيما
Allah Ta'ala says, Wallahu yuhibbu as-sabirin. Allah Ta'ala is lief with Adikina.
School governing body of South Coast Madrasa.
وسلموا تسليما حتى تنالوا جنة ونعيما صلوا عليه وسلموا تسليما حتى تنالوا.
Good morning, ladies and gentlemen and distinguished colleagues. This morning I would like to touch on looking at injury prevention, management of associated running injuries. My passion in sports medicine and orthopedic surgery is related to rugby, of which I'm very passionate about. And I will draw parallels between rugby and running related injuries and how effectively we can manage associated disorders which you will find in both sports. Now, historically, you will find that we were hunters and gatherers. So hunting is probably the oldest sport known to mankind. And when you look at the southern part of Africa, you will find that the San population have been doing hunting and gathering for at least 20,000 years. So they're probably one of the oldest athletes in the southern part of Africa. And subsequent to hunting and gathering, we then developed sporting activities and sporting codes. Running forms the fundamental basis for all sporting codes. Now, the significance of sport in South Africa is that our late President, ex-President Nelson Mandela, was very supportive of sport, and he used rugby as a tool to emphasize the importance of how sport can unify a nation irrespective of our backgrounds. So in 1995, we won the Rugby World Cup, and that was an important, momentous occasion in bringing our nation together at a very important historical time in South Africa. Subsequent to that, I had the privilege of being involved with the 2007 Rugby World Cup. And again, that particular event unified a nation. Now, running as a sport requires an immense amount of self-discipline and self-motivation because it is an individual sport. Tim quoted, "Your body will argue that there is no justifiable reason to continue. Yet, your only recourse is to call on your spirit, which fortunately functions independent of logic." And that's the mental power and the mental capacity that we have as individuals to excel. And if at first you don't succeed, you can always become an ultra-marathoner. Quote, Bruce Willis. Now, a scientist by the name of Mitchell, he classified sporting activities. And that's based on the load and the intensity with which your body has to function. So when your heart has to contract against high pressure, we define this as either low, moderate, or high static exercise. And when the heart has to function with an excessive volume of blood, we define this as dynamic, low, moderate, or high. And when you look at rugby as a sport, it fits in the category of moderate static and moderate dynamic, whereas running, especially long distance running, fits into the category of low static but high volume related activity. So rugby fits into this category, and historically hunting would fit into this category of low static, high dynamic. And similarly, Bruce Fordyce would also fit, like the sand population, in this particular activity profile. Now, what does exercise do, and how do one's body adapt to the workload and intensity? Well, there's certain changes that take place. So what happens is that your heart adapts to a particular given workload or intensity. So your heart adapts. So it becomes thicker in diameter, and it expands to accommodate the large volume of blood that the heart has to pump to the exercising muscle. There's certain muscle changes that take place, and with that, the energy system changes accordingly, so you're able to fulfill a high demand activity. But what is imperative of exercise is that you need to exercise at a load or intensity that's appropriate for your body to meet those demands. And the challenge for individual athletes is to exercise at this level of intensity. And at times we may find that the demands are in excess of the body's ability to cope. And that's the challenge for you as individual athletes and for us as sports physicians and practitioners, to make sure that you exercise at the appropriate level without overloading the body. Another scientist, Hans Selye, he developed the concept of adaptation energy. So when you start training, you find that your body goes through an alarm reaction stage, and by acclimatizing to the particular level of activity, your adaptation energy increase, and ideally the cardiac functions, the musculoskeletal systems adapt. And ideally, you need to adapt and exercise at this particular level and maintain your level of fitness at the appropriate level, so that your demands on the heart and on your body is not in excess. So your muscles adapt, and they adapt accordingly. So muscle is made out of muscle fibers. It's attached to bones via tendons. And muscle is made out of different types of fibers. You have two types of muscle fibers. You have type 1 muscle fiber, which is your endurance type of muscle fiber. And then you have a very explosive type of muscle fiber, which is called your type 2 muscle fiber. And what exercise does is that exercise provides an electric current to your muscles. And depending on the amplitude of the electricity going to your muscle, you will either recruit type 1 muscle fiber or type 2 muscle fiber, which is more explosive muscle type fiber. So genetically, we are endowed with a base of which we will have a preponderance either to be a long endurance athlete or a sprinter. And through the electrical activity and the prescription of the exercise that we utilize, we will then have a preponderance of either type 1 or type 2 muscle fiber. So when you look at individual rugby players, like forward rugby players compared to backline rugby players, you'll find that sprinting athletes will have a predominance of explosive type 2 muscle fiber. And through exercise, you then also modulate the percentage of these type of muscle fibers. So an athlete like Bolt will have a predominance of type 2 explosive muscle fiber, whereas an athlete like Bruce Fordyce and yourselves as long distance runners or athletes will have a predominance of type 1 muscle fiber. So what is the practical significance of these muscle fibers? Well, the energy utilization systems is different. And it is important to understand and to utilize then the appropriate energy required if you're a sprinter or if you're a long distance runner. Because when you start doing long distance activity, you find that you utilize fat metabolism more efficiently. So the emphasis then becomes on utilizing fat and mobilizing fat stores in order to be successful in the sport that you're involved in. So in a nutshell and in a simplistic form, you need to decide whether you use or run on diesel or gas. They're similar, there's differences. And trust me, I had the privy of borrowing a diesel bucket. I filled it up with fuel, and lo and behold, I got stuck. So I know from practical experience how disastrous that can be. So your energy system adapts over time. And this slide demonstrates that your capacity to utilize fat improves over a period of time. So there's 2 points I'd like you to look at this particular graph. And the first point is that through exercise, the organs that's responsible for burning fat improves. But it takes 4 to 5 months, at least say 3 to 4 months actually, before you start adapting to your exercise level. But if you stop exercising, you have a steep drop in performance. So it takes you 3 to 4 months to adapt, but when you stop exercising, you fall rapidly back to the level of where you started. And that's the challenge for us, is that when you have an injury or a musculoskeletal disorder, we need to keep you at that level so that when you return back from your rehabilitation, you are still at the same fitness level as where you started. And that's our challenge.
صلوا عليه وسلموا تسليما حتى تنالوا جنة ونعيما صلوا عليه وسلموا تسليما حتى تنالوا جنة ونعيما صلوا عليه.
Now, you want to exercise at a level where your body is able to adapt. If not, and you have an overload, it puts too much demand on the body, and unfortunately, every now and again, you find an athlete dying on the field. And it is not uncommon, it is a reality. Now, sudden death in sport is a real entity. And most young individuals, when they do have sudden death, is normally an identifiable cardiac abnormality. The biggest concern for us as sports physicians and orthopedic surgeons is that the clinical pickup rate to establish if an individual has a cardiac anomaly is very challenging. And our threshold to pick up cardiac abnormality, if we don't do echocardiography, is very, very small. It's a bit scary. But the good news is that it is uncommon. And this is a list of causes of sudden death in athletic activity. The two components which I'd like to emphasize, which is appropriate to running, is heat stroke and drug abuse. Now, as I've mentioned, your heart will adapt. But despite these adaptations, there's been a question in the sports science literature, and that is that does the heart muscle actually tires out with exercise? And the basis for this concern was that in 1978, 2 marathon runners presented with water on the lungs. And there was no identifiable medical reason why they developed water on the lung. And hence the concern was, does the heart muscle actually tire out after excessive exercise? Or is it just a normal physiological response whereby as you reach your threshold for your body or your heart to function, does the volume of blood that your heart injects tapers down? Because what you pump back to the heart, if your heart's unable to pump the volume back out, you have accumulation of fluid, and that causes pulmonary edema. Layman term, it is known as water on the lungs, which can be fatal. So what Tim Noakes and I did is that we did a study to ascertain whether the heart muscle actually tires. But what is important is that when you exercise, you have a large volume of blood going to your muscles. And when you stop exercising, when the muscle pump do not contract actively, you have pooling of blood in the muscles, and that can cause your blood pressure to drop, and that can cause you to collapse. So what we demonstrated is that when you maintain the blood volume back to your heart, in other words, when you maintain your preload, the heart actually doesn't have any dysfunction with regard to contraction. What our study also showed is that just by elevating your legs after a long endurance activity, you maintain your blood pressure. So quite often when you exercise as individuals and you stop abruptly and you feel dizzy, elevate your legs. That will improve your circulation or continue moving until the necessary adjustments take place and you're able to maintain your blood pressure. So for every activity, there's a specific exercise prescription and a specific workload and intensity that you need to follow and follow appropriately. Now there are individual needs. This particular oil painting demonstrates the different stages that women go through their lives. And the point I would like to make here is that individual attention and age-specific appropriate attention to your workload and your intensity is important. So when you undergo your period of exercise and you have a periodization program that you follow, again, you need to fulfill a function at that activity so that you don't cause any harm on the body when you're exercising. Now, in rugby, one of the biggest challenges with Jake White for 2004 and 2007 was this whole concept of periodization. And the challenge that I faced with at the time was that we weren't appropriately adapting to international tournaments because we had a small window of opportunity to have active rest and to strengthen for the ongoing season. And this was our challenge. And at that time, we were competing with elite athletes. And these athletes had a time frame where they could rest and strengthen up, compared to our athletes, which had a very narrow window to actively rest and to strengthen up. And at my time as Springbok Rugby doctor, our concern was that our athletes were fatiguing, they were overloaded, and we couldn't make them stronger for the 2000 Rugby World Cup if if we weren't going to change this particular periodization problem. So during my 4 years, one of the successes is that we changed this particular activity, both as a group and, more importantly, on an individual basis. We were able to improve that. And I could scientifically quantify that we made our athletes for the 4-year period, we made them faster and we made them stronger over the 4-year period. And mentally, we were able to improve their mental status. But there were problems during this time frame. And you'll ask yourself, so what's the clinical significance of adapting appropriately to a workload or intensity? Well, instead of seeing acute ligamentous injuries in rugby, I was seeing runner type of injuries. And the reason being is because when you increase your load or intensity, the muscles and the tendons are unable to adapt accordingly and to function. So when you do an ultrasound with athletes that's overtrained, or back in my day, this is what I found. Runner-related injuries where you have tendon thickens and calcifies. And those are the type of problems that I encountered back then, which I also encountered in running. And we needed to change that. Now, not only in running, but in rugby, there's another component. And the other component is when muscles fatigue, you put yourself at higher risk of injury. So what are the preventative basic strategies that we need to follow? Well, appropriate warm-up and stretching is important. And my colleague will elaborate further in the discussion. But the basic principle is a principle of an elastic band. If you freeze an elastic band, compared to an elastic band that you put in warm water, you'll find that the tolerance and the threshold for failure for the frozen elastic band is lower compared to a warmed up elastic band. That's as simplistic as that. Then, we find that a lot of lower limb related problems is related to inflexibility and poor conditioned musculature around the core. So not only is it important to stretch and adequately stretch the core muscles, but also to strengthen, and I'll show you an article that have elaborated on the significance of this fundamental condition that we need to do. So I will touch on common running associated problems which you may encounter in your field of sport. The one condition is the iliotibial band syndrome. Quite often when you run, you feel a bit of pain on the side of the leg. Now anatomically, we're all designed different. So there may be certain anatomical factors which you may not control, but when we screen athletes, we will pick those anatomical conditions and we may intervene. For example, if your foot rotates excessively or if you pronate excessively, those are anatomical variants that you may not have control, but your screening, we may pick up and intervene. And then as usual, especially during this period of time, we want to push volume of training, so our mileage increase. But when you do that, control the variables in terms of the camber and the surface on which you train. And we normally manage this condition by reversing the problems which we can identify. And when need arises, then we may have to do surgery. Now the other condition, which is a very common condition, is muscle-related cramps. which we all have experienced in all sports. Now, the one component I'll briefly touch on is exercise-induced muscle cramps. Now, there's a whole host why your muscles should cramp up. Hence, your screening for medical conditions is important, because that you can control, or if you're on specific medication that can cause muscle cramps. But if you develop the more common exercise-induced muscle cramps, what happens is that Martin Schwellnus did a lot of studies and research on this particular disorder.
صلوا عليه وسلموا تسليما حتى تنالوا جنة ونعيما صلوا عليه وسلموا تسليما حتى تنالوا جنة ونعيما صلوا عليه.
When you increase your low intensity, the muscles and the tendons are unable to adapt accordingly and to function. So when you do an ultrasound with athletes that's overtrained, or back in my day, this is what I found. Runner-related injuries where you have tendon thickens and calcifies. And those are the type of problems that I encountered back then, which I also encountered in running. And we needed to change that. Now, not only in running, but in rugby, there's another component. And the other component is when muscles fatigue, you put yourself at higher risk of injury. So what are the preventative basic strategies that we need to follow? Well, appropriate warm-up and stretching is important, and my colleague will elaborate further in the discussion. But the basic principle is a principle of an elastic band. If you freeze an elastic band, compared to an elastic band that you put in warm water, you'll find that the tolerance and the threshold for failure for the frozen elastic band is lower compared to a warmed up elastic band. That's as simplistic as that. Then, we find that a lot of lower limb related problems is related to inflexibility and poor conditioned musculature around the core. So not only is it important to stretch and adequately stretch the core muscles, but also to strengthen, and I'll show you an article that have elaborated on the significance of this fundamental condition that we need to do. So I will touch on common running associated problems which you may encounter in your field of sport. The one condition is the iliotibial band syndrome. Quite often when you run, you feel a bit of pain on the side of the leg. Now anatomically, we're all designed different. So there may be certain anatomical factors which you may not control, but when we screen athletes, we will pick those anatomical conditions and we may intervene. For example, if your foot rotates excessively or if you pronate excessively, those are anatomical variants that you may not have control, but your screening, we may pick up and intervene. And then as usual, especially during this period of time, we want to push volume of training, so our mileage increase. But when you do that, control the variables in terms of the camber and the surface on which you train. And we normally manage this condition by reversing the problems which we can identify. And when need arises, then we may have to do surgery. Now the other condition, which is a very common condition, is muscle-related cramps, which we all have experienced in all sports. Now the one component I'll briefly touch on is exercise-induced muscle cramps. Now there's a whole host why your muscles should cramp up. Hence your screening for medical conditions is important, because that you can control, or if you're on a specific medication that can cause muscle cramps. But if you develop the more common exercise-induced muscle cramps, what happens is that Martin Schwellnus did a lot of studies and research on this particular disorder. And what happens, the reason why you cramp when you exercise is that you have a stimulation of muscle contraction, because the pathways that's supposed to downregulate it or stop it from activating do not function adequately because of aberrant pathways that follow along your spinal cord. So what do you do when you have muscle cramps? You need to override the stimulatory pathway by overstretching your tendon structures so that you can stop this aberrant, abnormal pathway from developing. And you know, as soon as you develop a muscle cramp, you overstretch it. And when you start stretching, you'll find that it actually makes the cramps worse in the first 30 seconds. But you need to stretch through that pain for at least a minute so you can override this abnormal cycle from taking place. But again, the one preventative measure is to make sure that you're well hydrated. And that's the one variable that you can control. And the other variable that do improve exercise-related induced cramping is a good stretching program. And again, condition, an adequate condition. So there's certain conditions that we can't control for muscle cramps, such as family history. We can't control our age, but we can control our weight. And we can condition adequately. And we can make sure that we're well hydrated when we perform exercise. The psychological parameters, there's no scientific basis that it actually impacts or is a cause of exercise-induced cramping. The other condition which fall under the shin pain that athletes encounter is stress fractures. And we see that often in practice, both as an orthopedic surgeon, as a sports physician. We see fractures under the so-called shin pain, which most athletes refer to. Now, stress fractures, in other words, the bone is bruising. And the reason why the bone is bruising is because the demand of the activity is in excess of the bone's ability to strengthen up. The bone bruises, and over time, the bone then fractures. So what are the predisposing factors that we need to be cognizant of that we may prevent? Well, again, abrupt increase in volume of training and frequency is associated. Poor muscle strength around that particular anatomical structure. And unfortunately, in the female population, when you have hormonal abnormality, especially associated with abnormal dietary habits, that predisposes to developing stress-related fractures. This slide just emphasizes that it is a very difficult diagnosis just using plain x-rays. And at times we may have to utilize very sophisticated tests to actually ascertain whether it is a stress fracture or not. Our management quite often is rest, but at times we may have to operate. Especially when you have a stress fracture on the hip area, then our tolerance for surgery is much higher, especially when it's on the tension side to the upper border of the femoral neck area. Now coming back to core stability, because that's the one parameter you guys need to control. and you need to implement an effective core stabilizing strategy, because that will decrease your chance of developing associated lower limb injuries. So you're not only stretching, but strengthening around the core stabilizers of your lower limb is very important. The other component, which I've mentioned earlier, is not only the muscle strength, but muscle fatigue. And one of the studies I did was looking at how does the muscle parameters change when you tire out muscles. So what I did with the national team, we tested them at rest. We then did the exercise testing. The muscles tired out, and we found that our ability and threshold to pick up individuals at higher risk improved by retesting when we tire out muscle groups. So in this particular athlete, you can see that the ability to maintain adequate posture after muscle fatigue dramatically changes. So your threshold and your pickup rate is much higher when you take the component of fatigue into account. The other concept is delayed onset muscle soreness, which you're all familiar with. Now, delayed muscle soreness occurs when you do an activity, especially an unaccustomed activity, or when you start very early in your periodization program, you find that the muscle aches a few days after the particular activity. What's more alarming is not so much the muscle soreness, but with muscle soreness, you have an associated weakness that occurs. So, again, looking back at rugby, whenever we had our rugby camps, whenever we found on a weekly basis that our athletes developed DOMS, or delayed onset muscle soreness, we then adapted our training program accordingly. And what did Bruce Fordyce do when he had DOMS? During the hard training phase, never be afraid to take a day off. If your legs are feeling unduly stiff and sore, rest. If at all sluggish, rest. If in doubt, rest. So that's how Bruce dealt with delayed onset muscle soreness, which was appropriate because it's not so much the soreness that's my concern, it's the weakness and the vulnerability to develop injury when you have weakened muscle structure. And again, when you have that with a component of fatigue, you even put your body more at risk of acute injuries and overuse-related injuries.
صلوا عليه وسلموا تسليما حتى تنالوا جنة ونعيما صلوا عليه وسلموا تسليما حتى تنالوا جنة ونعيما صلوا عليه.
Now the last component I'd like to discuss is exercising in the heat. And that's a big concern. It's a big concern because when you exercise in the heat, you increase blood circulation to the skin. The skin, unfortunately, then accumulates blood, and there's no active pump to pump that excess blood in the skin circulation back to your heart. So what happens is that your cardiac output decreases. So you have less blood going to the rest of the body, which makes yourself very vulnerable to hypertensive-related problems. So your core temperature increases, your skin tries to adapt, and through different mechanisms, your body tries to cool itself down. Now, when you look at your wet bulb globe temperature, which is a figure that we utilize which takes into account the environmental temperature, the humidity, the wind speed, and the solar radiation. It gives you a number, and that number is a predictor of how likely and at how high a risk you are of developing heat-related stroke. And the one component that's very important is the humidity. So when you look at a fixed temperature, environmental temperature, as you increase the humidity, your relative risk of developing heat stroke increases. These are the risk factors for heat stroke. Again, there's certain variables that you can control, of which hydration is important, adequate sleep, and then heat acclimatization programs. And the Americans have devised this particular program to acclimatize to an environment where there's high temperatures and high humidity. And they recommend a 2-week program where you have a day of rest for every week of adapting. You have at least one practice day, but not more than 3 hours. And then from day 6 onwards, you have 2 exercise practice sessions, but you need at least 3 hours in between the 2 sessions. And then you gradually increase the intensity and load during that 2-week period. And maintain hydration with either 5-10% carbohydrate solution with adequate amounts of sodium and potassium. Now, as an orthopedic surgeon, we utilize musculoskeletal ultrasonography very frequent in sports-related injuries. Because not only does it define the pathology, but it allows us to give a prognosis. For example, here, this particular runner's knee, we are able to quantify the diameter of thickness, and we are able to predict prognosis. In other words, which athlete is likely or unlikely to develop to a conservative approach. And when you have acute injury, we're able to quantify how bad the injury is. And you'll ask yourself again, why? Because we don't want athletes to rest inappropriately for a long period of time, because it means, like the previous graph I've shown you, your level of performance drop back to where you started. And that's the challenge. We need to keep your level of fitness to the appropriate level while we're doing your rehabilitation. So in closure, sport is a unifying activity of which running forms the primary foundation. And through cumulative individual conditioning, this translates to team success. And individual success can either be within yourself to achieve personal improvement and gain, but through individual adaptation in certain sports like rugby, we achieve a collective unifying achievement for the sport. And as I've alluded to in the beginning of my presentation, that is not only unifying for groups, but it brings a country and it unifies a nation. So I thank you for your attention this morning.
Okay. So basically, we've heard now that flexibility is very important. Okay. Why is it important? Basically, you have a decrease in your injuries, to improve the range of motion of your joints, okay? Also improve circulation. And then often athletes or in general people just don't know how often they should be stretching. So we usually advise once a day you should be stretching 3 to 7 times a week, and you should be holding your stretch for 30 seconds. Often we have, I hear people come to me and they say, I'm holding my stretch for 10 seconds. 30 seconds is the advisable time to get that ultimate stretch. And also what we do find is often people overstretch. They don't gradually stretch. So it should be a gradual thing. You shouldn't go immediately deep into your stretch. You should be taking it gradually. And also we find also that people tend to bounce while they're stretching. You need to actually stretch and hold for the 30 and then take it a bit further. Okay? So the main stretches that I am going to cover is basically your glutes. I've included a muscle with that called piriformis. Often people don't know about that muscle. It's a deep it lies quite deep underneath the glutes. And often when that muscle is tight, you get a sciatica kind of pain that people often complain of. Then you often have the patient say they're having like a sciatica, where they're having a disc problem or pinched nerve. Often it's just that that nerve is getting irritated because it runs under the piriformis, and it's just because your piriformis is tight. Okay? Your ITB, very important in runners. A lot of runners come with ITB tightness, most probably because they're not stretching it enough. There are many issues, other issues why your ITB could be tight. Hamstring stretches. Often many people, whether you run or not, you present with tight hamstrings. It's a common thing, especially people suffering from lower back pain. It is one of the muscles that tend to get tight and stiff in conjunction with the muscles in the lower back. Your quad stretches, adductor stretches, which often I find a lot of runners don't stretch. Your calf and your TA is your tibialis anterior, that is the muscle on the front of the shin, often the one causing your shin splints problems. Okay. So there's so many stretches out there. You can Google these things and you find a lot of things. Sometimes it's not actually the right stretch for that muscle. I've just chosen what is more or less the most appropriate ones that I would administer to my clients that come to me with a tightness, okay? But as I said before, I want to stress this is if you do not have an injury, okay? So first you have this first stretch over here. These two are the same stretches, just done in different positions. So the one is used in a sitting position, the one in a lying position, and this is usually to target the gluteal area, your glutes muscles.
First of all, running is the basis of most sports in terms of adapting to any particular exercise, whether you're doing rugby, cricket, sport. Running is the basis and the fundamental activity where athletes gain fitness. It is important for any particular activity or event to make sure that conditioning is appropriate, the workload and intensity is appropriate for that individual, and many times there are certain identifiable factors and components that can be addressed to prevent injuries from taking place. So it's important to understand that there's general conditioning and adaptation that needs to be fulfilled to prevent certain injuries, and also general medical related conditions that may be attained during a particular activity. Overall, exercise is important. It promotes general health, it promotes good quality of life, and also the benefits for individual is immense from a psychological component. And cumulatively, the benefits for the individual translates to the benefits on a more global scale. So often, individual sports from different countries may be a unifying attribute which brings countries and individual populations, it brings the entire nation together when there's success on an individual base or on a group base in team or competitive sports. I think I was very privileged to work with Tim Noakes, not only during my career as a sports physician, but also during the Rugby World Cup period. I have lots of respect for Tim, I value his opinion, and for a man of his immense stature to be very humble, yet have a very scientific approach and a very professional approach is one of the key features that I admire of Tim.
Okay. Often most people don't know their foot type, if they have a flat foot or they're pronating. Pronating is basically you more weight bearing on the inner part of your foot. So often what clients will come into us and we'll pick that up, that there is a flat foot or they weight bearing more on the inside. So often with that I send the client on for foot assessment. Because sometimes you're wearing the wrong kind of running shoe for your foot type, and that is actually causing biomechanical changes that's causing you to be prone to an injury.
And then just generally, besides running now, I mean, how does that affect,
Usually the foot type, often it's the way your foot was designed. You were born with a foot like that. It could be because of how your foot developed in your younger years as well. So some people don't have any issues. It's maybe when you have a change in a certain activity, or you start a new sport, or maybe you bought a new shoe, and then they start getting issues, and that's when they obviously come to us or a doctor, and they pick up on the flat foot, or they're not weight bearing in the right areas, and that is often where we will send them on. But most often, if you're not involved in like a sport or any new activity that you took on, then you don't usually have issues. Yeah. The event went really well. We had a good turnout, and also I think we targeted a lot of runners, which was quite good, especially now before the 2 Oceans. So everything went smoothly, went great, and the talks were actually very, Dr. San's talk was very interesting. I also learned a few new things there, so it went well overall. Yeah.
صلوا عليه وسلموا تسليما حتى تنالوا جنة ونعيما. صلوا عليه وسلموا تسليما حتى تنالوا جنة ونعيما. صلوا عليه وسلموا تسليما حتى تنالوا جنة ونعيما. صلوا عليه وسلموا تسليما